Simply Motsoka.
Breastfeeding within the first hour is very important
Yeah.
for you and the baby, actually.
Is it? I thought it was for the baby. I didn't know about the mom.
It is very. So what happens is that with breastfeeding, it actually helps to contract your uterus.
Oh, Rafukata Kaba.
And to also help you to prevent bleeding.
Oh, okay. I didn't know that.
Yeah. So sometimes some women actually they complicate, especially after the cesarean section, where we call it.
Okay.
My colleagues would be so shocked that I don't know why it slipped my mind at the moment.
You will tell us, we'll pop it on the screen, don't worry.
Postpartum hemorrhage, that's what it's called.
Postpartum hemorrhage. Okay.
Yes.
I've heard that term before.
Yes. So breastfeeding is actually very helpful it's an important preventative step to take to sort of avert that, one of many, of course, because it helps to contract your uterus. So when your uterus contracts, then it minimizes the bleeding.
That's something we didn't know. You see, we need more education from you guys so that you teach us, the patients, so that we have an understanding. Now I'm going to move back a little bit back onto the profession.
Okay.
You are wearing a beautiful uniform with
Yes.
some stripes on your shoulders. Can you tell us what those mean?
Okay. I must apologize. Some actually fell off. I need to get new ones.
Okay.
But the stripes, so the red thing, maroon, that you see here, it is called, so this whole thing is called an epaulette.
Okay.
And this signifies that I have qualified as a professional nurse.
Okay.
Okay. And then this one was supposed to be green.
Okay.
But that signifies the fact that I have qualification in being a midwife. So I'm a midwife. And then the black one, navy rather, that signifies that I also am a psychosocial nurse. So I can work. Yes, I can work in
the psych. Okay.
Yes.
Psych wards and all those.
Yes.
All right.
And then the yellow signifies that I can work in primary health care community settings as well.
Okay.
And be a community health nurse. So that's what it means.
I've always wondered what it means. So now tell me, because you said you work for the state, now if you had to move into the private practice space, how will that structure work?
I mean, you just apply, really.
Okay.
So you mean from a public hospital to a private hospital?
To a private hospital, yeah.
Okay. Yeah, so I'd have to just look out for posts in the private health sector and go through the whole interview process. If I am shortlisted and if they take me, then I can work there. Okay. Should I choose to. But however, there's also a new midwives are also just gaining a very independent recognition, where they can practice independently as well and sort of open their own practice and be private in that sense.
In their own state.
Yeah.
Which now moves to my next question, because I wanted to ask you being a midwife, how would you expand your career in that space? And obviously you'll have to have your goals aligned. Maybe let me ask you this. What are your goals? And outside of being a midwife, what is the way forward?
Okay. My goals.
Yes.
So I would like to see myself, which I have started already, right? Just really pioneering a healthcare, not system per se, but a model of care that I believe is very effective, which is ideally what should be taking place everywhere, public or private, and that is called a biopsychosocial spiritual model of healthcare.
Okay.
So
that sounds very interesting.
Yes. So I would like to one day just open a practice, right? A physical practice, whereby when I look at a woman who is pregnant or who would like to conceive, I do my consultation around all of those different facets of life, because that they all are interconnected in one way or another. And I guess the precursor to that is what I have started at the moment, right? Which is a platform, really, and a movement, I'd like to call it, of women that I do consultations with, just to sort of give health education, really, through. It's called. So we use primordial. So primordial is like things that affect health.
Okay.
Right. At a more outside of like immediate things, like maybe getting immunizations or whatever, so like more at a systemic level.
Okay.
Yes. And also just primary prevention of disease, so things like I told you, health education, so just raising awareness on just a whole lot of things that affect women, like for example, just if a lady is struggling a lot with period cramps, period pains, and it is, it's really affecting a woman's daily activities. They sort of can't function because of that. Then I sit down, talk with the woman, and just go through just some of the things that
could be a challenge.
That could be a challenge, that could be contributing towards that, and just walk her through helping her change some health behaviors. And
so that's some like a wellness support center of some sort.
Yes.
Okay, that's actually great, because I know a guy who wants to start doing wellness events. So something similar that okay.
Yes.
Now that's quite good, and I think it will give us the details so that we can be able to showcase them, so that when people are reaching out to you, they know how to get hold of you. But that is amazing.
Simply Motsoka.
How do you manage relationships at work, especially because you work with different people? I mean, patients, your superiors, medical doctors. How do you get to always make sure that how you present yourself as a nurse comes across properly on the other side?
Oh wow, okay. So I mentioned teamwork in the beginning. So healthcare professionals can never work in silos. And I think the challenge is when we see that manifesting a lot, in practice, where you get the doctors.
There's the doctor on the side,
and the nurse, and they're not like, they're just there, But now it's a challenge because the goal is one, but you're working in silos, and I think that should just constantly be what is at the top of our heads, is that if our goals are aligned, then obviously, inevitably, we should be working, together. We call it a multidisciplinary team. Where it's also not just the doctor and the nurse, but because a person is, there are many facets to a person, so the dietitian should also be involved, should there be a need to physiotherapist, so we all should be working together for this common goal of seeing an individual well recovered and being discharged. But however, there are challenges where, I guess in any workplace, conflict does happen. Whether it's between nurses and nurses, or nurses and doctors, or with your superiors. And I guess your question was, how do I deal with that?
Yes.
I think for me, first and foremost, it's important to understand the root cause, right? Of why this is happening. And what I am seeing of late is that a lot of ill behavior, that we are seeing in practice, especially, between the professions, and also between the professions and the patients, which is especially in our midwifery obstetric field. There's a whole term actually around it called obstetric violence,
Wow. Okay. All right.
Obstetric violence, where just like we have gender-based violence,
Yes, yeah.
the healthcare professionals are the ones who are the perpetrators,
Okay.
who are acting in an abusive manner towards women during this period of their lives. And the root cause to that is obviously, it's twofold. I think there's what we can account to just individual personalities that need to be worked on, just going through conflict resolution, but also there's the cause of burnout.
Yes, I was about to think. I'm thinking that could be burnout. Yeah. Yes, because I've seen on TikTok there are so many nurses that are doing videos about complaining about being burned out and all.
Burnout is it's a pandemic, actually.
Sure.
In this field, it is such a pandemic because a lot of midwives, a lot of doctors, a lot of us are going through just periods of being, it's not even just being tired, but it's an actual condition that needs attention.
Yeah.
And the cause is manifold. It can be the main one that I'm seeing at the moment, that is the cause, is what I have been mentioning throughout this, and that is just not having enough staff.
Yeah.
Yeah.
Sure, that's quite hectic. That's very hectic, and I hope that throughout this whole conversation we might have some people that can give some advice on how we can have a solution going forward.
Yes.
But thank you for sharing that. Now I want to know, in closure, if I was considering becoming a nurse, what is the journey? And I would love for you to share a little bit on how can I get myself registered. Let's assume now I'm now thinking of going into nursing as a field.
Okay.
Now, when I'm done as a nurse, how do I get myself registered as a nurse so that I can now say, you know what, I'm on the market and I'm available? Do you guys have a council of some sort, maybe that you can share some insight on?
Yes. So for you to qualify, so if you're someone who's considering this profession, you go through school, also depending on what kind of nurse you'd like to become. So,
yeah, like the stages that you've explained. Yes.
So for example, if you want to be a midwife, you can either go through the university and do your 3 years. Actually, now it's 3 years, no longer 4. And then after that, so you go through. I must just double check whether, because things have changed.
Yeah, I think things have changed now. But I think maybe for now we can focus on maybe the council. How do you get yourself to be registered and have? I know with doctors it's a PC number where you have your practice number.
Yes.
So with the nursing, how does it work?
Yes. Okay. So upon finishing your qualification, you have to go through a mandatory year called community service.
Okay.
And then after community service, then you apply through the nursing council, and the nursing council then sort of gives you your qualifications as one who is now eligible to work as a midwife. So you receive a SANC number.
Okay.
A SANC number, yes.
All right.
So so that's just a number that SANC sort of use as a regulatory body.
Okay.
Yes. However, also, so that's the role of the South African Nursing Council, which is SANC.
Yeah.
They're just a regulatory body, so they regulate the profession, and not so much, giving you the platform to get promoted or, and then say you would like to go into private practice, then what you would then have to go through is receiving a practice number
with the HPCSA.
Not the HPCSA. The HPCSA, I think it's for other professions.
It's for doctors
and physiotherapists. Yes,
Okay.
the other professions within the health space. But it's through the Board of Healthcare, BHF.
Oh, BHF. Okay.
Yes.
Okay. All right. I know BHF. Yes.
Yes.
Oh, okay.
So you need to go through them to get a practice number, and then go to people like Simply Motsoka.
Yes.
To assist with marketing,
And
if
setting up your practice.
setting up your practice, if you'd like to take that route, and go through all the admin. I mean, we don't. We just know, what we need to do, but all the other things, we didn't get trained for that.
I heard that. I interviewed a few doctors and they said, we don't get trained for, maybe universities should bring up a business management course.
Yes.
And I'll come and train that course.
Yes.
Yeah, but that's quite good. And I'm sure that's the route that at some point you would want to take.
Yeah.
Yeah, no, that's very good.
Yes, I would, yes. So please look out for if you want to have a baby again.
Yes, I am planning to have another baby.
Okay.
Yes,
so
I am. By God's grace, I plan to have another baby.
You know who to come to.
I'll definitely do that. But thank you so much, Nurse. I just think with everything that you've shared, you've brought some insight. Certain things that I didn't know. I never knew that nurses are burned out. We never look at it in that manner at all. I mean, I really appreciate you giving us that insight.
Simply Motsoka.
Yeah, but I think for anyone who's watching, you can pop any questions that you have and we'll get Nurse Lungile to come and answer them. She can respond. And I think we are done with the interview. We'll have another phase to have another session. I think I want to explore more about this burnout part. But I think let's digest it first offline, and I would love to understand that. But I'm always thinking about money, right? So I'm kind of interested. Of the levels that you have asked, and the profession of nursing, does it pay enough in South Africa?
No.
Sure. Okay.
No, it doesn't. And I think that is why we have such a huge rate of brain drain.
Yeah. Because the hours are long.
Hours are long, and that is a main push factor away from, we spoke about retaining nurses.
Yeah.
So this salary one is actually a push factor that prevents retaining or retention of nurses within the public health sector, or even the private health sector. Like if you're employed as a nurse in a private hospital, because the rates are more or less the same.
Okay.
So it's in levels, right? So level one, you could. Should I give? I don't know, like exactly.
You can give estimates.
Annual.
Yeah, but I mean, really, if a person really want to know how much you earn, they can Google it. But I just wanted to understand on a higher level.
Okay. Yeah. So I mean, it's for example, if you grade 1 nurse, right, and you're a midwife, I think on a monthly basis, it's just under 30,000.
Okay.
Which is, I guess, not enough.
No, it won't be enough
for, especially because you are working. So we work 40-hour 40-hour shifts, right, per week.
That's a lot of hours.
Yes, and it's not, I mean, depending on where you work, but in a hospital setting, it's not like your normal 9 to 5. So shifts usually start at 7 and they end at 7. And this is both night shift and if you're working day shift as well.
Okay.
And I guess that is also another thing maybe that can be looked into, because the other complaint I'm constantly getting, from my colleagues is that especially women who are mothers, is that this does not allow time to spend with your family and children, because I find that a lot of my colleagues they actually don't live with their children. Children live with
maybe grandmother or someone.
Yes. And there's also just compromise. We are the ones who usually preach breastfeeding, exclusive breastfeeding for at least 6 months. So if maternity leave is like 4 months, and now after that you have to go back to work, how is breastfeeding possible when you have to be at work from 7 in the morning until 7 in the evening as a new mom?
Yeah, that must be tough.
That
must be very tough.
Yeah.
Sure. Stuff that we didn't know. I didn't know that at all. But thank you also for sharing on that one. I think we will digest it further when we do part 2 another day.
Yeah.
Just but thank you again for sharing what you have shared with us. I really appreciate it.
I almost feel like
is there something we want us to? We can go more.
I mean, I just wanted to also say that it's a lovely profession, because I mean,
yes, I actually wanted to ask that. Maybe
I didn't talk about that.
Yes, let's maybe bring something positive outside of all of this. Yeah, what are the pros and the cons of your industry?
So I mean, I think the main one is that as a nurse, as a midwife specifically, you are basically like a steward of life.
Yes.
And this is not just the life of a mom, but it's both a mother and a child.
Baby, yeah.
And a new baby throughout in utero, whilst the baby's still in the womb during pregnancy and even afterwards. So just having that first encounter and, just seeing that whole process of life coming into the world is just very fulfilling. And I guess being of help.
Yeah.
Just seeing that I have made a difference. A mom has probably come in feeling not so good,
Yes.
not feeling, that she has the capacity to go through the whole labor process. And I, as a midwife, I get the opportunity to empower the woman and assist her in that regard is just very fulfilling. Seeing her, just at the end of it all, having gone through the labor process and, just seeing how she's bonding with the baby,
the best part.
And it's just so fulfilling. So I would really just highlight that as something very positive about the profession. If you want to help people, if you love women, if you love children, please consider being a midwife. We need people to become midwives.
Yes. So yeah, that is beautiful. I mean, like I said, I've had 2 kids, and a nurse has always been there. I'm still in contact with the ladies that helped me when I gave birth.
Yes.
They attend my kids' birthdays, and it's been a very, very strong bond, and very amazing.
Beautiful.
And we really, really appreciate you. We really appreciate you. We appreciate your colleagues. The hours that you are putting in, that effort. I think on behalf of all women, I want to just say thank you. And please don't give up on us and be patient with us as women. Sometimes we become very impatient as well from a patient point of view. I mean, when you are in labor, you're very stressed. I've never given birth naturally, so I can't say I know that experience, but I know the experience of being in a labor pain. And I want to say thank you. And I love your uniform.
Thank you.
Beautiful. You look amazing.
Thank you so much.
Simply Motsoka.